Meeting is being recorded.
Hi everyone, thanks so much for joining us today. We have a lot of folks joining the platform all at once. We maxed out on registration of 1,000 people. So we're gonna give folks time to join and get settled. So we're gonna get started in about 6 minutes. Everyone has been muted upon entry. So if you like to chat, if you're having any technical issues or have any questions, please use the chat box and make sure you're chatting to all participants. I also will be putting in the chat box instructions on how to join via phone to connect to audio. So we're going to get started in about 6 minutes. Thanks again for joining us. Hi everyone, thanks so much for joining us this afternoon. We had our maximum number of registrants register for this conversation today. So we have a lot of folks who are joining all at once. We're going to give folks some time to get in and get settled and let technology work. So we're going to get started in about 3 minutes. Everyone will be muted upon entry. So if you have any questions or need any technical support, please use the chat box. You can go ahead and chat to all participants to make sure everyone can see your message. I'll also be putting in the chat box instructions on how to join audio via phone. So again, we're going to get started in about 3 minutes. Thank you.
Welcome, everyone. Thank you for joining today's Managing Now for a Better Tomorrow conversation. This is Denise Solzbach. I am Director of the National Center at the Institute for Innovation and Implementation at the University of Maryland School of Social Work and Deputy Director of the TA Network. We are going to be tweeting throughout this discussion. If you'd like to join us, please use hashtags BetterTomorrow and TA Networks Talks. And please tag us at Institute SSW. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially the families and the youth we serve. We have created these conversations to have peer-to-peer opportunities for you to talk with the presenters as well as one another. We encourage you to use the chat box to share your thoughts and resources, as well as questions for the presenters. And I see you're doing a great job at that. Keep it going, keep introducing yourselves. When you use the chat box, please be sure to select all participants. That way all of us can see your comments. In follow-up to today's discussion, we will send everyone who registered a link to today's recording, as well as resources shared in the chat box. This will very much be a conversation today. You will see the presenters joining us from their homes, and we will not be using a PowerPoint during the discussion. And this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. We truly value your participation in today's discussion. And similar to last Thursday, we may especially need your partnership today. The East Coast continues to experience high winds. And while we may not see snow today in Pat Hunt's window as she joins us from Maine, the weather here has upped its game with tornado warnings. So if you lose us, please log back in. If we lose you, please stay with us. We have a troubleshooting team ready to assist with backup plans, and we're getting really good at this. So as I mentioned, this is a conversation series during COVID-19. Some of you may have joined us for some prior conversations. We do have recordings available for crisis communications. That was held on both March 25th and March 31st. We also had a conversation about in-home behavioral health held on March 26th. We had another conversation on Thursday about supporting families, and as Sarah mentioned earlier, we met maximum capacity not only on today's discussion, but last Thursday's as well. So we do have a recording of last Thursday's conversation, and perhaps some of you had joined us as well. Finally, we've had a conversation about residential care and residential services, and that was held last Friday on April 10th. Upcoming discussions include infant and early childhood mental health, taking place on April 14th at 3:30 p.m. Eastern Time, and mobile response and stabilization on April 16th, that's Thursday at 3:30 p.m. Eastern. We're also working on, and we'll be announcing dates shortly, about conversations on how to support tribal communities, housing instability and homelessness, rural healthcare, and school mental health. And for school mental health, we're looking at two separate. There'll be two in the series, one about supporting students and their families, and the second about supporting caregivers, supporting educators and administrators. To learn about our series and to access other resources, please go to the Institute at umaryland.edu/COVID-19. You can also sign up for the TA Telegram to receive weekly e-blasts of resources coming out, including conversations, and we'll post that in the chat box for you. And today's conversation, as you know, is about a conversation on supporting families during COVID-19. And I'm very proud that our partners at Fredler have joined us again today. So your presenters today will be Pat Hunt. She's the Executive Director of the Family Run Executive Director Leadership Association, Fredler. She's joined by Millie Sweeney, the Deputy Director. Millie will be facilitating the questions and answers. And Jane Walker, she's a Senior Advisor at Fredler and former Executive Director. You also have experts or other participants in the chat box with you, namely Liz Manley. She's with us at the Institute for Innovation and Implementation at the School of Social Work at the University of Maryland. Many of you may know Liz, as she is also the lead technical assistance support person for several system of care sites and non-system of care sites across the country, and she leads our clinical and workforce best practices work. Also joining us today is Christopher Balanci. Dr. Balanci serves as the medical director for the TA network. He comes from the Judge Baker Children's Center at the Harvard Medical School, and he'll be here to support you as well. And with that, I'm going to turn this over to Pat Hunt. Hi, Pat.
Hi, thanks so much. What a nice introduction. We're really delighted to facilitate this timely conversation today, and we're grateful to the University of Maryland's Institute for Innovation and Implementation for hosting this call. As you can tell from earlier discussion, there's been a lot of very important topics covered recently and rapidly, I would say, as well. While we are a bit overwhelmed with the turnout for the call, we're delighted so many people are joining us, and we appreciate the time that you've given today to do this, because we know you're super busy doing all the other things that life has brought your way recently. So my name is Pat Hunt, and I am the Executive Director of Fredler. We're a national network of family-run organizations supporting families caring for a child, youth, or young adult with mental health needs. And I would also like to thank my colleagues, Jane and Millie, for bringing their skills and passion to this work today, and appreciate Dr. Balanci and Liz Manley for the time that they've given us for the two presentations that we've done, and for all their other work as well. So thank you. Most presentations end with a thank you, but we want to begin this conversation with a really huge thank you. Over the past few weeks, we've had contact with many family-run organizations and family leaders across the country. And we're so impressed with the dedication and adaptability of the organizations, and particularly of the parent peer support providers, who continue serving families and youth with their creativity, their humor, and their skill, and what seems to me endless or boundless energy for the families that they work with. So we want to say thanks to family-run organizations for responding with creativity, to parent peer support providers for being dedicated and undaunted, and to providers, administrators, and policymakers for supporting families and the organizations that serve them. We also know that the family leaders are juggling the needs of their own families in the midst of serving families. So we want to begin by acknowledging this amazing work and thanking everyone for going above and beyond to serve and support the families you work with, and to say we know you also have new responsibilities, and we deeply appreciate you joining us today. Whatever class you might have been in the midst of with your homeschooling and other new obligations, we appreciate that you took a break to do this. The focus over the past 30 days, it seems a bit more than that now, has really changed, has really shifted. If you look out the window, it seems normal. We would hope spring is in the air. Somewhere people are enjoying crocus. I know you are. I'm not yet, but I will be soon. But in the last 30 days, life as we have experienced it has had unprecedented change, and it's had impact on all of our daily lives. So our ability to go shop or go to school or work or travel or worship or have recreation has really changed. And our natural inclinations to be together are being discouraged or forbidden or somewhere in between. As one family member said in our conversations, our family hugs all the time. And one of their family members said, I really miss hugging and that sense of touch that we've had with one another. Instead, we have daily reports of numbers and more numbers and more numbers, and of people with the virus and the number of fatalities. And masks and gloves and hand sanitizer have become household staples when and if you can get them. If not, all the other make-do items have come into play. Even in the best circumstances, families struggle with confinement and managing daily life. I know I struggle with confinement. As I shared with people the other day, I feel a bit like when I was a young adolescent and told I couldn't go somewhere, all I could think of was that was where I wanted to go. So perhaps that's a bit of the rebel in me, I don't know, but I certainly do hearken back to that time. And families caring for a child, youth, or young adult have additional stressors and concerns as well. So Jane, there's been some themes that we've heard from family leaders in several of our calls. I wondered if you wanted to take a minute and talk about some of those.
Sure, Pat. As Pat mentioned, we've had calls with numerous organizations across the country, family organizations that are dedicated to serving families who have children with mental health needs. And first and foremost, we were struck, as I think we all are, about how family organizations are providing support using technology. We also heard many cries of the need for accurate information, a strain on daily living, things such as food and shelter, the impact on milestones and traditions in families, the impact on emotional well-being for the children and for the parents, managing home schooling and daily responsibilities, and of course also organizational change that has happened as a result of this unprecedented time we're in. We're going to kind of touch on each of these bullets one by one, and in the chat box is a link to kind of an overview of each of these themes that we've heard, so you could follow along if you wanted to download that. So the first one we're going to talk about is the use of technology. And, you know, doesn't the world exist on Zoom these days? But even before that, what struck us about talking with family organizations was how they involved the families in designing what it was they needed on technology, such as one organization, while the kids were all on spring break, the family said, oh gosh, we need something every day for our kids, and we need something every day for ourselves to get us through these 2 weeks. So the family organization scheduled morning groups for young children. I'm saying young elementary school, late morning groups for middle school, adolescent, and then afternoon groups for the parents. Every day they held those 3 groups, and that was at the parents' request. It went so well that when spring break was over, the kids were, of course, online at school, not back at school. Parents said, we've got to keep it up. They changed it, however, to be 2 times a week instead of 5 times a week. So what they did was involve the families in what that looks like. And another organization told us the parents said, you know what would really help is if we got a text message every morning with just something upbeat to get us going on the right foot each day. And then they wanted like a 20-minute check-in online using Zoom. So asking families what they needed and how that could be done was actually what struck us more than even how they used the technology. We know they're doing a lot of one-to-one peer support using phone or Zoom. There's an amazing number of online support groups for parents and for youth. Daily text messages, as I said, regular phone call check-ins, using social media for creative activities like sharing pictures or hosting coffee breaks. One organization told us that they just decided to keep everybody upbeat. People would share pictures from something that happened every day in their life. Somebody had a daffodil blooming in their yard and they shared it with the group. Somebody else baked a cake and they shared that with the group, just as a means to stay connected, to stay positive, and support each other. Phone trees set up to help each person connect with somebody else. So all of these are ways in which family organizations are using technology and how they've solicited help from the families to design what that looked like for their families. So one of the thoughts we had was to ask you how you have engaged families in designing what their support looks like. We know that not every family has access to a laptop or a computer. So those are certainly considerations in with many families. There certainly are phone calls and even notes in the mail. Mail is still running, so that's even a possibility. But just creatively looking at how you can utilize technology and how you have engaged families in designing what that online support is. There's somebody saying we use telehealth. Anybody else? How you've engaged families in designing what that looks like? Well, some people are putting in the chat box. I just wanted to say that currently there is a letter to Congress that has been signed off by many national mental health organizations to provide funding for virtual peer support programs for individuals, including group support meetings for individuals with behavioral health conditions or substance use. So Fredla has signed on to that, but we feel we're seeing such a wave of this. We also know that it's so effective that this could actually be a milestone in helping this technology become more accepted and reimbursable. So I see things here like sending letters and photos through the mail, phone calls, FaceTime. Somebody said they did a survey with families to ask what they needed. That's fantastic. A checklist that review with parents and kids. Those are great.
Jane, I think we learned as well in our discussions, some folks began to do, to have their conversations with families in the evening because they were so busy doing other things all day now
That's
that they
true.
wouldn't normally do.
Yep.
And one organization said that they were shifting funding from canceled events to be able to purchase some technology items for the families who didn't have it. I thought that was really creative too.
That's great. That's great. I see a lot more things coming in. That's fantastic. There is a question here about Hipaa, and maybe we can address that a little bit later. It's an important one, and it's one that SAMHSA and CMS have had some adaptations to the Hipaa to be able to do support groups and things. So we'll get to that shortly. But the next kind of theme that we heard was about information. So it's misinformation as well as information overload. Questions about who do you trust? Questions about what do you say to children and youth, especially children with special needs? And balancing information while not unduly creating fear. Truly, these days, watching the news can be detrimental to your health. Information abounds, and it's difficult to sort what is accurate from what is not. So, as family support organizations, we can ensure that families get access to reliable sources of information and encourage families to control the amount of news coming into the house. It also, you can also help families explain to their children what is happening in a way that does not terrify them. Families have reported their children are terrified, having nightmares. They're especially concerned about their parents who may be considered essential workers and they have to go out every day. The children are worried. Are their parents going to become ill? Are they going to bring it home and they might become ill? Heard one grandmother who is caring for her 3 grandchildren say, the children can't sleep at night. They're so worried about what's going on. So encouraging parents to calm their children's fears while talking openly about what is happening. The Child Mind Institute has many resources for families to help them deal with the COVID-19 pandemic. I know I have a daughter with special needs, and it took me quite a while to explain to her what was going on. She thought I was being restrictive and saying, no, we're not going to the stores are closed. It really took a lot of effort to try to explain that this was not me imposing restrictions on her. And this wasn't just happening in our house, it was happening all over. Trying to do that without raising undue fear, it is a difficult challenge at times. If there's young children, or if you have special circumstances, such as a parent who is considered an essential worker, or if you have a child with special needs, all those make this balancing information without creating terror. I see somebody saying we've been reaching out to special ed directors to encourage them to work collectively with us as we support families. Yay to that. Anything else I missed on the chat here, Pat? Lots going on. So Pat, you want to talk about the next item, which is about daily living?
Absolutely. So the next topic that families brought to our attention was the strain on daily living. And they talked about being in unstable or crowded living situations. Shelters were closing. Some families lived in cars or lived in one hotel room or motel room. And it was it's been very hard, I think, for the parent support providers to be able to reach out and engage people and help them where they are. I think they've been really creative about doing that, however. But you can imagine if you're a family of 4 and you're living in one motel room that's pretty cramped and crowded, can lead to a lot of stress. Kids have a lot of the energy that they need to burn off. They need activities, they need things to do. Hotels have been, I've read many articles where hotels are working with others in the community to help bring entertainment and activity for the children to the best of their ability, but it's probably not the norm that you would hope that they could get. They are including exercise in that, so that's really good for the young people and their parents as well. There's been an inability to purchase or a scarcity of necessities, and I think Jane had a conversation with families in Florida who couldn't get formula for their babies or diapers, pharmacy items. Food banks have there's a huge shift in the number of people that they're serving now. I know in my little town last week, there were 50 families normally come and there were 141. So that tells you that the drain is enormous everywhere you turn. There are financial concerns with reduced hours or loss of employment and bills being due and overdue. There are people who are working in fear. That would include people at the hardware store, people who are in building supplies, people who are first responders, people who are picking up our trash. I mean, lots of people are doing this work and are coming in a lot of contact with other people. They're afraid they will get the virus or take it home to their families. They're also afraid that if they bring the issue up, there'll be some retaliation at work. Health disparities is enormous. At this point, the racial disparities around the virus are really impossible to ignore, with African Americans seeing higher rates of hospitalization and of deaths. Officials in St. Louis, Detroit, and a large swath of states reported that African American populations have been hit especially hard. A look at the data helps explain why, because behind the well-known daily numbers of the pandemic, the cases, hospitalizations, and death, is a mix of geography, socioeconomics, health factors that make COVID-19 particularly dangerous for some minority groups. In Illinois, Blacks represent 16% of the state's population, but 30% of the number of people with the virus. In Chicago, they represent 70% of the people who have died from the virus. And in the Hispanic community in Oregon, there 18% of the cases are Hispanic when 13% of the population is. So a Center for Disease Control and Prevention study of the virus found that 33% of those who have been hospitalized are African American, although they only make up 13% of the general population. There are also higher rates of infection and death, where in Arizona, rural areas are harder hit than urban, exacting a disproportionate toll on communities that are thin on medical care and basic infrastructure. And nowhere is that more evident than in the Navajo Nation. In Arizona, the nation is home to 1.4% of the Arizona population, but it has more than 13% of the state's COVID cases. And in New Mexico, the rate of infection is almost 8 times higher in the Navajo Nation than in New Mexico in general. And the rate of death is about 16 times higher for those people living on tribal lands. So certainly health disparities are a huge consideration at this time. I had a question, I think, for you there. Did I miss it? Yes. So what strategies are you using to cope with stress when you can't access your usual means? Maybe the gym is closed, or the bowling alley is closed, or people that you normally would go for a jog with are not going to do that with you. What kinds of things are you doing to relieve your stress? Free yoga online, meditation. I missed one above that.
Yeah.
Walking outside with a friend on the phone, crocheting puzzles, crafting, prayer, walking my dogs, cleaning, cooking, baking, journaling. Boy, there's no end to this. Calm headspace, knitting, reading, sleeping, playing games with our family, learning new video, YouTube exercise.
So I must be the only one that had, as I don't see eating on here anywhere. I can only speak for myself that eating has become a real pastime. Oh yeah, eating. Okay, thank you. Whoever you are.
We're all too close to the refrigerator right now, aren't we?
Yeah.
Thank you.
My admiration for all of you who exercise and meditate. My snacks, soup, you're on my people here. Need to social distance from the refrigerator. Yes, probably 5 foot at least. Sure.
At least move it downstairs so we get some extra exercise to
Yeah.
into it, right?
So there have been additional concerns about safety, and I did see previously in the chat box talking about the additional stressors increasing abuse and neglect, and that can either be abuse and neglect of children, or we're also reading a lot about spousal abuse, and that the isolation is reducing reporting and investigation. And so that raises a huge concern. Unfortunately, we have seen some very tragic situations, not just in this country, but elsewhere. I read in the paper this morning. And so as people who are in contact with children, with their caregivers, finding new ways to have those conversations, which could be more difficult if the in the but it's critical that we, closely monitor the safety and well-being of the children and their families. Access to even routine healthcare may be limited or postponed in this time. Certainly, elective surgery may be on hold, and who knows when things like elective surgery might even be scheduled at this point. As again, parent support providers, making sure families check their child's medication, making sure that they have the refills. I know I had to call this morning when I realized we were on one of our daughter's last medication, and also making sure that their health insurance information is readily available. Several people have also in the chat box talked about safety plans. And those safety plans could be very, very helpful. I see somebody about a safety plan if someone is confirmed to have a virus in the household. And I think Millie, we can certainly get to that in a little bit. I also wanted to bring out the special needs of families who may have a child in a residential program or even in detention at this time. Those families have additional worries about the welfare of their child, different shifts coming in and going out. I know our daughter is in a residential program with 3 different shifts, and we made the decision to bring her home. And that was not an easy decision at all to make, because it meant making tremendous adaptations in our household. Realize not every family can do that. But if a child needs to remain in a residential program, it's really important that that program maintain ongoing daily communication with the family and the child have daily communication, but that the residential program inform the families what steps they have taken to protect the child's health and safety at this time. I know I got an email on a Friday afternoon from my child's provider that they were no longer having families visit. And while I entirely supported that program, that policy took place immediately, and I had no time to even talk with my daughter and explain to her why I wouldn't be coming, as I have done every Saturday for years. So just being mindful of what the protocols you're putting in place and informing families and helping them explain to their child, giving them time to plan and prepare for those changes. Pat, you want to talk about milestones and celebrations?
Oh, absolutely. Thank you. I was noticing some comments going by as well. People getting dressed up for dinner sometimes. I thought that was nice. I love the idea of quarantine sweatpants. That would be a great excuse to get something new shipped in anyway. And Facebook postings. And so I want to say, I think Facebook postings have played a huge role in sort of sharing those milestones and traditions. You know, we talk about birthdays and school and sporting events, spiritual and religious holidays, graduations, weddings, end of life, the celebrations, and honoring those who have made the journey. Our society celebrates milestones in different ways, and all families have a variety of traditions. And these are just a few of the milestones we celebrate together. The fact that hospitals now, some don't let anyone in, but if a mom is giving birth, some let one person in, which means, you know, if there were siblings, they can't come now to see their new brother or sister, or the grandparents may not, you know, so it's just a different way. So I think having technology and having Facebook has allowed people to share some interesting new ways that they're doing these traditions. And what comes to mind that made me smile was the way Lisa Conlon shared her desire for all of her family members to show up with their own homemade hat for Easter. And so I think Lisa had painted a milk jug green and cut it to fit on her head and had flowers growing out the top of it. I mean, it was just all sorts of silly pictures from the family. But it was a way in which they all could stay connected. And students, especially seniors, will certainly miss out on graduations this year. And many families are caring for a loved one who may have contacted the virus and who may be in the hospital. And in the current situation, families not being permitted to visit makes it very difficult for everyone. And particularly when young children are involved, it's really hard to understand. So we'd like you to take a minute and share some creative ways you're supporting families or staff to celebrate their milestones or to deal with their losses. Have been people already been doing that and I didn't see it. I may have. I've seen a church car parade ride through my neighborhood, maybe small for sure. This is difficult on our IDD population like my son. He just doesn't understand why he can't go out from his home, why he couldn't come home for Easter, and why we can't visit him.
Right.
Hard stuff.
And Jill had mentioned earlier in the same vein that even though her son is the only person in the residential program, there's still worry about if the staff are adhering to the protocols. You know, the staff have children, they go home. Who are the children in contact with? But there's a lot of very uplifting things we're seeing here as
Absolutely.
well. Love it about
FaceTime, reading stories together at night, video chats.
have we not all learned the importance of connecting with each other? And in some ways, this is a great equalizer, and not in the sense of healthcare treatment or identification, but an equalizer in the sense that we see the humanness in everybody. We see television personalities who have not had access to a makeup artist or hairstylist, and they look like they need a haircut just like I do. So in some ways we are learning about each other, that we are all human, we need each other, and we're seeing it come out in so many rich ways. And family organizations are, as Pat, you said early on, are just going above and beyond to be able to, under the best of circumstances, find it difficult. But under this, if you have a child with special needs, it is particularly challenging.
We talk about local theaters doing Zoom happy hours, a virtual bat mitzvah, virtual CETAs, virtual egg hunts, family chats, all good stuff. Thank you.
Yep.
Nice. Holding virtual prom with friends from your home while dressed up in your prom dress.
Very good. Very good.
Great.
So the next thing we wanted to talk about was the emotional well-being. That probably underscores every aspect of this discussion. The added responsibilities caregivers have, being a parent, being a teacher, being the recreation and activity director, being the referee between siblings, being the cook, and at the same time worrying about your job, your finances, and possibly managing your own anxiety. All of this combined can lead to caregiver burnout, lack of sleep, and more. It's the feeling of connectedness that's more important than ever, and we can't say it enough. And assisting parents and caregivers to take care of themselves, and at this time, helping them access treatment for themselves if they need it, if you sense that they need it. Unfortunately, at this time, we're seeing increases in suicide, during this time of isolation, and family organizations need to be prepared to support people who need it, listen keenly, and help people prepare for prevention, intervention, and postvention. So Christopher, maybe we could turn to you for some things. First of all, there was a question about Hipaa, and then after that, the discussion about well-being and supporting families, but also taking care of ourselves, and a question about developing safety plans. Christopher, you mind stepping in here?
Sure, happy to. And thank you for including me in this rich conversation. And I just love the creativeness of this group and what's going on in the chat box. So kudos to all of you for not letting the coronavirus get in the way of finding novel ways of staying connected, because I think that's just so critically important in this time. Related to the Hipaa guidance, I did post in the chat a couple of times some of the Hipaa guidance relaxation that the federal government has offered. And that allows for some of the platforms that we use for telehealth to be used even if they're not currently Hipaa compliant. I think your best bet is always to try to use a Hipaa compliant format. And there was some comments about Zoom not being Hipaa compliant. There is, the free version is not, but the purchased version is Hipaa compliant as far as I know. And the TA network has also had a nice consolidation of some of the guidance from states that was also posted, and Michelle can post that again for everybody's interest. If you go to the Technical Assistance Network at University of Maryland's Innovation Center for Innovation and Implementation, they've got a really great map that has some of the ways in which local jurisdictions have been changing some of the rules around Hipaa compliance. Tell me again what your second question was, Jane.
Well, there was a question about a safety plan.
Yes.
Yeah.
You know, I think it's really important to be thinking about ways to bind our anxiety. I think one of the things about this pandemic is that it's feeling like control is being taken away from us. And so I think anything that helps us to feel like we're back in control is going to be really essential and therapeutic, frankly. And so I think being able to prepare for some of the inevitabilities or actions that might occur. So for instance, there was some chat about what happens if someone in my family gets sick and how are we going to manage those circumstances. I think figuring out whether or not you've got a dedicated space where you can put the sick person and maybe have dedicated people to watch over and care for that sick person so you can try to minimize the spread. If you do have access to personal protective equipment or can work with your primary care provider to get some, that might help to minimize the spread throughout your house. And then trying to know what are the signs when I would need to escalate this, i.e. bring them to an emergency room or try to arrange for a consultation with your primary care practitioner. The critical aspect is really fever. You know, there's lots of allergies going on because we are in springtime and flowers are in bloom, and that brings on seasonal allergies. A sniffly nose or even feeling a little worn out, that's really not a sign of COVID-19, or at least not a concerning sign. Certainly, many people, 80%, have more mild symptoms associated with this virus. It's really if you've got a fever above 100.3, and you have some respiratory symptoms, that's when you start worrying that you may have been exposed to the virus. And I would really strongly encourage you reaching out to your primary care clinician about what next steps. Most people can stay at home and be okay. The concern is that, of course, everybody else in the household may be catching that same virus, and wanting to make sure that you try to, almost like we're trying to flatten the curve in society, if you can flatten the curve in your own home so that caretakers aren't all sick at the same time, that would be ideal.
Yeah. Millie, I know your husband is considered an essential worker. Maybe you could talk about the plan that you have in your home.
Sure. So my husband is not in healthcare, but he is considered an essential worker. So we have in place now when he actually gets back in his car from work, he has antiseptic wipes that he uses immediately on his phone because he uses his phone all day at work for alerts and alarms and that sort of thing. And then when he gets, and he also wipes down the car. When he gets to the house, he comes in through the garage, and we have a little station set up there where he goes ahead and he strips down, and his clothes stay out there for at least 24 hours. And then he immediately comes in and showers, and we just try to limit the interaction until he has done those things. We also have made the decision for our children to be elsewhere. They're not in the house with us right now for a couple of weeks, just to make sure that they are not potentially exposed, because he is exposed to the general public all day long, 6 and 7 days a week sometimes. So that's something we put in place. And Jane, I wanted to mention, and I was hoping Christopher, I tried to catch him before he got off, but if you could speak to this, Christopher, we had mentioned an increase in potential for suicide. And I know in my state there's been an increase. I just noticed that our suicide prevention network is going to do an online QPR instruction, question, persuade, refer, which is something that anyone can do. But there were several questions about increases. Is there a publication on this? Any literature? I didn't know if Christopher, if you could say something about that.
Sure. Suicide rates were actually increasing well before the pandemic. We've seen notable increases, particularly in African American adolescents over the last decade. Some rates as high as a 35% increase in suicide, both in adults and in young people. So we saw those trends even before the pandemic, and the nature of tracking these kinds of trends is such that we don't really have good data right now on how the pandemic is impacting suicide rates, because there's always going to be a lag in gathering that data. Somebody was asking whether or not the CDC is tracking racial disparity data and whether or not that's being reported at the CDC website. And I don't actually believe that they were even starting to gather demographic data. That's really happening at the local level. And so we've seen in Boston a twofold death rate for African American and Latinx populations compared to Caucasian populations in Boston and Massachusetts numbers. Similar disparities, Pat was quoting from Louisiana, from Illinois, and certainly from New York City. And so once again, we're seeing, people who are racial minorities, African American and Latinx and Native people having greater disparities, which may be related to greater numbers of underlying health conditions, living in close proximity, or also being part of a workforce that doesn't have the choice to work remotely and are still working in frontline jobs in various service industries. And so once again, we're seeing the disparities being most prominent in some of the most vulnerable parts of our society. And I think it's an opportunity to call that out and do advocacy, so we're ensuring that we have access for all members of our society in an equal way. And I think there's a number of opportunities through this crisis to be thinking about active advocacy work to ensure that we, within this crisis, there is opportunity to try to affect the kinds of changes that we all believe in. There are very big checks being written at the federal government level. $2.2 trillion CARES Act was passed, having a lot of federal dollars flowing down into state and local governments. And you'd want to make sure that those dollars are going to the people in greatest need and in an equitable way. And that is the kind of advocacy that all of you are so good at. So make sure that the funding streams are providing the dollars where they are most needed and will have the greatest impact. And then also use your advocacy voices to ensure that there aren't barriers to service delivery that have historically been present. This is a time when those rules are being relaxed. And so this is a way to ensure that we can provide the kind of care that we know is so important to families with children with behavioral health needs. And my guess is that at the end of this, some of those relaxation of rules will be institutionalized. That it'll be hard to get the genie back in the bottle. And so think strategically about how you can not take advantage of this pandemic, but the pandemic is here whether we want it to be or not. And so how are we going to try to make this come out right for the greatest number of people?
Right. Yeah, Christopher, you raise a good point. I think organizations need to really be documenting what they're seeing, not just the usual type of reporting, but making documentation about what it is they're doing differently and how that is having a positive impact. Monumental shift in how services are provided and what is now reimbursable, perhaps, although I hate to take it back to dollars and cents, but that's often where it goes. Liz Manley, you're on too, and perhaps there's something you'd like to add to this conversation. And I know specifically around maybe because we know that there are health and safety plans related to this virus. And families who have a child with mental health needs may also at this time, if they're living in such confined quarters, need a health and safety plan just for their child's, to manage their child's behavior. Do you have anything you want to add?
Yeah, let me just add a couple things even before that. Let me just tag on to the telehealth technology and let you know that that's the telehealth technology that's allowable now in New Jersey is what I had been advocating for years to try and get into place because we saw the value of it. And the second that the governor signed it into action in New Jersey, the teams there started to say, we need to track, right? We need to be able to tell the story because we had been talking about it for such a long time about the power of that. So crisis can equal opportunity, and now's the time to really pay attention to that, the impact of those telehealth strategies that are working. So I just wanted to point that out since we were talking about that. And getting back to the what's happening for children and families in their homes and what's going on there, I do think what we have to provide as many strategies for families as possible, recognizing parents have a ton of new and awkward responsibilities, right? So for some families, it's the first time that they're working from home, so they're learning new technologies themselves. They are trying to make sure they stay on top of their work, and then on top of that, now taking care of their children who they're used to them being in school. Some children have communication challenges in which it's hard to actually communicate with them on a regular basis. Some have challenges around attention and around, so it's really important, I think, to work with teams, right? Whoever's been on that team and maybe the addition of teams, addition to the team to come up with strategies around structure that will work for youth during their day. I'll give you an example. In the world of wraparound, we would use these 24-hour clocks to tell us, you know, how youth are doing and when we could put new resources in place for them, when we could put, you know, when would they have a therapy session, when would they be playing, when would they be doing their homework, when would they be eating dinner. I think that kind of concept of making sure that there's enough structure in place that includes playtime, it includes the things that youth like to do, and have the ability to do, and then has the other parts of the structure in place as well. I also think we have to forgive ourselves a bit, right? We're all trying new things, and we're trying new things together, right? So professionals who are used to being face-to-face and in the home, such as care managers and mobile response teams and
in-home therapists are all learning new things. And together, I think we'll be supportive of each other. But we have families who are learning new things too. And so I think we have to be forgiving of each other as we really work through this together. And we rely on each other as we're working through some of these things together. But when it comes to children specifically with intellectual and developmental disabilities, I think we might need some actual, resources that are really planful in their nature for those particular youth, in particular, increasing the level of time and strategies around making sure that our youth feel comfortable and are supported.
Very, very good. I will share with the group that I woke up this morning at 6 o'clock, or I was awakened this morning at 6 o'clock with howling and screaming and pounding. This is my daughter with special needs. And I thought, oh my God, it's not even 1 week. And it's so, I can't stress enough the impact that each of us on this call are experiencing with our own families, and maybe it's not screaming and howling, pounding at 6 in the morning as it was in this house, but it's like Millie's, where her husband has to, sterilize himself before he comes in the house. This is just impacting every single family in so many different ways for structure and support as well. So that's a perfect entree, Pat, into the daily living.
Well, yes, thank you. So another topic that came up was, managing the homeschooling and all of the added responsibilities that are coming down the pike with this. Not only the planning of how are you going to get food, where are you going to get food, when are you going to get food, who's going to go get the food, the things that you used to just stop and do, but then setting up the structure at home and making sure that as a parent, you're trying to meet academic needs, including those special academic needs, to include activities and exercise routines, and the unique needs for a variety of age groups. I was delighted last week when in my daughter's family, my younger daughter's family, she has 2 sons who are, one is 12 and the other is 5. And when the 12-year-old decided that mom was reading the book in the evening with the 5-year-old, because he's really moving rapidly forward in his reading during this time, so that's good. He decided he wanted to be part of that too, and finished reading the mom's part of the book that she was reading and read it to his little brother. So he's like sort of elevated now to a new position of heroism because he took time with his little brother to do that. So, sort of making sure that you can include all of the age groups and some of the activities is important. Balancing work from home with children being home, the calls, we're on calls with family members coming through, with dogs barking, with babies crying, and sometimes Jane, I'm the one who's doing the screaming and stomping, so I'm not blaming that on anybody else in my house. And establishing in-home protocols. So I feel like summer is relaxed and schedules are less rigid, but this is April and youth are supposed to be in school, and helping families establish a routine can help parents and caregivers feel that they have some control and helps their children understand expectations and have more predictability in their daily lives. And that's really important to get them to that point. So they've been suddenly put in the position of having to homeschool and closely monitor their academic needs for some parents, this can be difficult, and that's not only because of the parents. There are some teachers and some schools that haven't done a great job of getting information to the parents about what's going on. I don't say that in a blaming way. It's just been a lack of availability of communication or technology or things like that. So I know I have a granddaughter who's going for her master's degree, and her professor did not know how to do a virtual class. And so she struggled for a couple weeks while they got to that point. And my brother-in-law, who is a professor at Salem State, they actually had to take the first week for all of the professors to learn how to host virtual classes. So I thought that was a great solution as well. Making sure that activities include exercise. We talked about earlier, you know, living in apartment buildings, that can be a little bit complex. If you have people doing jumping jacks and somebody's living downstairs, that may not make good neighbors. So it has, self-isolating has unique challenges for different age groups. And while younger children may need more supervision and older youth may challenge the need to isolate or feel like they can spend all day in bed. So there's that little bit of challenge too, like, wait a minute, isn't this a school day? This isn't a Saturday and you don't get to sleep until noon. And I think we've talked earlier, you mentioned about people who have allergies and whatnot, being looked at by people in public like, oh my gosh, don't get near her, she's sick, or, you know, giving you that evil eye sort of, why are you out in public? Because we know you're sick. So I think sort of balancing all of that requires a lot of energy and a lot of patience. So really, there's been a change in process and protocols. We learned from family organizations. We've also learned this from practitioners and mental health providers. As we've had discussions, there's been changes not only in how you do your work, such as you know, relaxed regulations, amended contracts, or new reporting structures, new ways in which you support your staff, new expectations, but also when you do your work, when are you available? Because many of you, regardless of what role you have, are also doing homeschooling and other things that are required of you at this time. And when are families available, and how can that match up? And does that add to your struggle, or does it sort of make it easier for you because you might be more available later in the afternoon or early evening as well? And how are staff being supported? So we know business meetings are taking on the new norm. There's high-level business meetings being interrupted by dogs barking and fussy babies and homework questions. And people's daily lives are being accepted into multinational discussions about strategy and product development, mergers and acquisitions. So there's a new respect for home and family across the board in places it never was before, which means corporate America, and beyond. So we have a question. What kind of significant changes have you or your organization made? And after we hear your answers, we'll ask if Liz or Chris want to weigh in as well. So what kind of significant changes have you or your organization made? What are you doing differently? Are you supervising staff differently? Are you being supervised differently or supported differently? Wow, that was big. Family contracts. Where did I see it? You're all moving fast now. Family contacts have gone from 4% of our work to 75%. Most of our staff have been teleworking,
Right.
for the time being, working remotely.
Pat, I can share an example that I heard in, since we've been having conversations
Sure.
with other family leaders. For example, in Oregon, the person who's over contracts has changed the contract currently so that the family-run organization, instead of getting reimbursed for monies, they are giving them the advance so that they can support their workforce. And then they're also relaxing or amending some of their reporting requirements so that it's easier to gather that information.
Mhm.
That makes it, that's an adjustment that they've done contractually to help them respond more effectively to what's going on right now and provide some family support. So that's one of the changes that I've seen.
Mhm. Thank you, Millie. Great example.
One of the
Another-
things, the uncertainty that we don't know is what impact we certainly have seen the unemployment numbers skyrocket. We know that more and more families will be in financial straits very shortly. It's interesting when we started these calls with family organizations and we asked the question about financial impact. It was interesting. That was not the issue at that time. People were getting their last paychecks or had not yet been notified that their hours were being cut, or if they were a private contractor, their contract was being uh, cut. And we're starting to see that wave now where the financial issues are going to maybe not overtake the mental health well-being issues, but certainly will equal and ramp up the emotional and anxiety issues. So
I love this. I love this one, Jane. It said, we thought we collaborated with our partner programs throughout our community before. That has increased a ton. Supporting each other's work to not duplicate and to fill in gaps where possible. It's inspiring.
that's wonderful.
I love that.
Yeah, that's wonderful. Yeah. So anyway, we
I wondered if,
may be seeing a second wave here where the financial issues, the concrete needs become paramount. And while we've seen struggles in accessing things, as you mentioned, Pat, like formula, diapers, toilet paper, we may now be seeing a very different picture where families cannot afford their rent or afford to keep paying for an internet if they do have a computer or things like that.
so I just want to underscore that times of uncertainty are times of opportunity. And I really want to thank those of you who have brought that to the forefront today. And I wondered if if Liz or Chris might have anything else you want to talk about at this time. Did you want to weigh in on any of these changing contracts or new opportunities?
Yes, I think what you're seeing in the chat box is incredible adaptability. And I think there is, in this kind of an environment, an importance to almost think about this in stages. So I like to think that we're kind of at the end of the beginning, and then there's a middle, and then there's an after. And I think the middle part of this that we're starting to move into is going to become the new normal for quite a period of time. And so even if we can get to a place where we start relaxing social distancing, some people are saying maybe May, maybe June, maybe summer, maybe the virus will diminish in the warmer, humid months. There's no guarantee for any of that. And we don't have a vaccine and we don't have medications to treat the virus, and hopefully those will come online much sooner than ever historically has happened before. But typically we're talking about a year to 18 months. And so what we're probably going to see is kind of an accordioning, so there's a period when we can relax a little bit and have more people back in the workforce, maybe those who have been infected and have antibodies against the virus. But there's probably also going to be periods when we're going to have to socially distance again. And so I think these new ways of adapting our practices are probably going to be here for a long period of time. And I think it's going to be important for us to know what's the impact of these new ways of service delivery, because I actually think there's going to be a lot of consumers that are going to actually prefer the new ways to the old ways. I'm hearing about a lot of young people who actually like telehealth, who had been difficult to engage in an office setting, who are now actually taking their therapist around with their smartphone, showing them their home and showing them other aspects of their lives that had been closed off to the clinical encounter. So I think there's great opportunity here to be innovative and to find new ways of overcoming some of the barriers that existed before we had this pandemic. And so I really salute and support all the creativity that I'm seeing played out in these chat boxes and conversations, which we will capture and share after we clean it up a little bit. We'll probably get it out to you by next week, so that you'll have those resources to share as well. Because I think the new normal is going to be different than the old way of doing business. And the way parent support organizations, as well as any of us, change and evolve is going to be determining whether or not you're still here on the other side of this pandemic, because it's a challenge, as we're hearing. And, you know, some businesses, some practices are going to go out of business. And we want to make sure that you're all there still standing and vital and in support. And just again, one more plug for advocacy. In Massachusetts, the state, despite, you know, the concerns about revenue streams and tax revenues, have increased compensation and reimbursement rates by 10% for provider communities. And, you know, I don't know where Massachusetts is getting that money, but if there are ways that you can try to steer some of the federal dollars that are coming down to states towards supporting and maintaining your practices and your service array, we really need you here during the pandemic, and we need you here after the pandemic is over.
Thank you. Liz?
Yeah, so I think there are a couple things to think about. One is that these new technologies can be incredibly helpful and to pay attention to, right? Pay attention to what's working and pay attention for the youth and families in which connection is not happening, because I do believe that we're going to both need these new technologies and we're going to need some of the old technologies that work, right? The face-to-face actual engagement strategies for families. And I think, you know, advocating for the broadening of that array is the way to move that, and to have the, you know, the opportunity to try new things has been really powerful. But we also want to remember some of the things that we also know worked, and putting them together in the long term. That's one. Number two, we have to remember, I think to Jane's point, that we're not just in one, not just dealing with one challenge at the moment. We have multiple challenges ahead of us, including the financial component of what's going on. With that are opportunities that are coming down because of the federal government putting a lot of resources in. What happens for children's behavioral health, and we tend to be the last ones in line, and it's really important to be advocating to be the first in line. If we don't, right, what we do know from some of the evidence from natural disasters like Katrina, and certainly my experience in New Jersey in Superstorm Sandy, is that youth who don't get their needs met end up costing a lot more money, time, energy, but more importantly, the traumatic components that go into place for families are just too devastating to get ahead of. So we really want to make sure that we're preparing for what I think is going to be a significant increase in the use of services and supports. And we'd like them to be really focused on things like mobile response and stabilization rather than inpatient care, right? So we'd like to put our resources so we can address the needs of more families and get there as soon as possible. And the third part is, I think we're going to have a new population of individuals we need to be attentive to. We have nurses and doctors who are on the front lines, who generally are not our first primary, you know, group of people that we're engaging with. on a regular basis, but I think we really need to be thoughtful for the folks on the front line on a daily basis and their experience of loss and grief and their and the impact on their children and their families is just going to be something we need to be attentive to. And I'll give you one quick example on the financial crisis. In 2008, I worked in one of the wealthiest counties in the country at the time. It's no longer, but and the financial crisis hit, right? Most of those people worked on Wall Street, worked in New York City, and the impact on that community was devastating at all levels, right? We had to be really attentive, but we came together as a community, worked together to make sure that those youth and those families got what they needed, both in the concrete services and supports, but also in the emotional supports that they needed in order for them to move forward. All those things are really important to pay attention to.
Thank you. So we'd like to take a second and let you know about the Science of Well-Being, which is a free online course from Yale. And the 5 things that help you be well. Things you can practice now. You don't have to wait. You don't have to wait till you can go out and shop. To do deep breathing. Acts of kindness for others. Boy, haven't we seen a lot of that in these last few weeks. A lot of acts of kindness for others. Focus on what you can control. Exercise and eat well. And Jane brought up that we're all eating well. We may not be eating right, but we're eating well. And to practice gratitude. I think that, that is one of the most powerful things that we can do is to practice gratitude. It helps us be humble. It helps us stay grounded. This online course had over 2 million people register, and these 5 tips were shared on the Today Show. And we hope that you find them useful as well. Millie, we've covered a lot of ground. I think we're down to about 6 or 7 minutes now. Is there anything in the chat that we didn't touch on or items that we should address?
We've done a good job actually covering things as they come up, but there are a couple of things. One, there has been a couple of requests for safety plans, and so I've included 2 resources for that, but we will be looking for a couple of more of those that we can include when we send things out. There will be a resource, a compilation of resources that also will go out to you. One is for kids, one's for families, one is for supporting families during this time, and the other is for organizations. What we have not really touched on is convincing people to stay in, particularly young adults. The safety concerns, when we were having a discussion about that, there were several comments about, but how do you get people to take this seriously and to stay home, for their own health and for other people's health. So I don't know if anybody wanted to touch on that. Anyone?
I can jump in. I think the issue of personal responsibility is so important, and I usually will talk about the particular vulnerability that this virus brings, because you can spread it before you're even sick. And so while checking a temperature is a good practice, it doesn't confer certainty that you're not still spreading that virus. And so I think our thinking has evolved, and people get on board with these kinds of new approaches, including the guidance to wear a mask now whenever you're in public. Is not something that people were saying even a couple of weeks ago, and now that's become the new normal. And so I think being willing to speak up and advocate when you see people behaving irresponsibly, just as you would with other behaviors that were irresponsible, and knowing that we're all in this together, and that your actions may not just impact you and whether you get sick, but can impact your community and others, including the elderly, your grandparents. have my 83-year-old mother staying with us because her 82-year-old boyfriend was not taking the concerns about social distancing seriously, and both she and I were really concerned about that. So there are consequences for our actions, you know, and they're missing each other terribly, and I would love for her to go back and be near him and outside of living under our roof again. But, you know, that was what made sense for our family. So I think we're going to be making different decisions, and actions have consequences. And I think we've been pretty clear that that's part of the reason that she's not in Florida anymore. So
That is true.
Was there another one?
I think there is the approach of that is, you know, looking at the facts. Somebody put in the box about kids, and I do think that that's a very difficult issue, because we know that, I mean, kids can look at the facts and still say, but that won't affect me. So I think that does present a very difficult challenge for families, especially as we noted earlier, some families may be living in very confined spaces where there isn't even a place for them to get away from each other for a period of time. I mentioned there's some PSAs out there that can be very helpful. They're done by sports figures, they're done by, you know, musicians, done by things like that, that may be helpful in getting the message across to some adolescents, youth, young adults who may be thinking they're, you know, not subject to this virus, which at one point it was stated that, you know, this virus did not really affect younger people as much. So as we learn more, the precautions change, and trying to get people to move to that point is a challenge. It truly is. And we have different areas in our country where it has not yet had as major an impact, and trying to get people to understand that in those areas is also a challenge, very real challenge.
There's also some great.
Julia Louis Dreyfus, yeah, that's wonderful. Yes, there's a lot of very good ones out there. Yeah.
So I want to,
Great animated videos as well that help people understand how, if you take personal responsibility, how you can not infect others, or someone who doesn't take responsibility, how they do affect others. Some great animated videos.
well, I know our time is up, so I want to say thank you again to Jane and to Millie and to Liz and to Dr. Balanci, and a huge thank you to all of you who participated today. We really appreciate it, and we hope you stay well.
Thank you, Pat. And this is Denise Solsback. On behalf of the Institute and the TA Network, I want to thank all of you. As you all mentioned, or several of you mentioned, your chat box, your participation, your contributions were truly inspiring and do truly show that together we are stronger. Please be sure to be taking care of yourselves as you're taking care of your families and your communities. And we really appreciate you.